Good morning. In this chapter, we are going to talk about cleft lip anatomical landmark. Before going to describe the full surgical management, we have to know about that cleft lip anatomical landmark. We given 1 to 10 numbers for landmark. Number 1 is this side is normal side, medial side. This side is the cleft side or lateral side. In the medial side, Cupid's bow peak we given number 1. Midpoint between the two Cupid's bow peak number 2. 3 is center point of the columella base. 4 is non-cleft side columella base. 5 is cleft side columella base. 6 is alar base. 7 is cleft side alar base. 8 is commissure in the non-cleft side. 9 is commissure in the cleft side. So we given number 1 to 9 for anatomical landmark, but in this chapter 10 and 10 dash it's very important, because 10 and 10 dash will come and meet in one point, that is the future Cupid's bow peak in the cleft side. So we have to mark 10 and 10 dash. See, for 10 we have to measure the number 1 to 2. See, in the 2 is it's a midpoint of the 2 Cupid's bow peak. If number 1 and 2 is 2 millimeter, means the 2 and 10 also should be 2 centimeter, 2 millimeter. The other one point is the 10 for marking the 10. The vermilion and mucosa of the upper lip will merge at the one side in the cleft side. That also indicates number 10. And this is the cleft side filter column. This filter column also will give some projection at this point, that also number 10. So we marked number 10 according to based on cleft non-cleft side Cupid's bow peak and midpoint of the both side Cupid's bow peak. See, for marking 10 we already seen that 10 to 2 is equal to 1 to 2, and for 10 dash, see here the 10 dash, normal side commissure is 8, normal side Cupid's bow peak is 1. The distance between the normal side Cupid's bow peak and normal side commissure is equal to cleft side Cupid's bow peak. Future Cupid's bow peak should be equal to this distance. 9 10 dash is equal to 8 to 1. Here you see 8 to 1 is equal to 10 dash to 9. Same like 6. Number 6 is the alar base in the normal side, and Cupid's bow peak is 1 normal side. So distance between 6 to 1 is equal to 7 to 10 dash. Like that we have to mark the 10 dash. Another one point is after marking this one, we see here the vermilion and mucosa of the cleft side lip will merge on one point. That point also indicate the 10 dash. So following these 3 points we will mark the 10 dash. See, after marking, this is the horizontal height of the lip from 8 to 9. Vertical height is from 4 to 1 is the vertical height. But here then the cleft side 5 to 10 will be shorter than the 4 to 1. So we have to we have to give more height on the cleft side. For that we will mark 3 flaps. Number 1 is rotation flap. Number 2 is advancement flap. Number 3 is columella flap. For rotation flap we have to make a incision from 10 to 3, and sometimes we need one back cut. For that we have to give one incision from 3 to 4. It should not cross the 4. If it is crossed, it will break the normal side filtral column, so it will be look not aesthetic. Okay, after marking this placing this incision, this rotation flap will turn downwards, so this 10 will come downwards. Okay, after making that incision, based on 3 and 5, we will get another one flap like this, that is called columella flap. This columella flap, if we are using this flap, pulling this flap upwards like this, it will come as a columella. If it is we are pushing that flap towards like this, it will come and give a nice floor for the nasal sill. Then we have to mark an incision at the alar base, and we have to join from 7 to 10 dash. Then we will get one flap, it's an advancement flap. This flap will advances towards the non-cleft side. So based on these three flaps, will give adequate vertical height for the cleft side lip. So on the detailed procedure we will see in the next chapter. But here, after making incision, we'll get, after making incision from 10 to 3, we will get a flap at the, like a green color flap will fall downwards. Then based on 3 and 5, we'll get columella flap. This flap sometimes we'll use as a floor of the sill, sometimes we will use as a columella. And this pink color flap now, this will advances towards the non-cleft side. Based on that, we'll get adequate height for the cleft side.